go to Mark and then to Victoria.
Thank you, Chair. Well, what a welcome amendment. Notwithstanding what Councillor Wenham just said about the technicalities of it and perhaps the last minute, this is the point of democracy and of listening to each other. And, Chair, can I say listening to the public? What we learnt in the last 5 years that I've been closely involved with this subject, and hence my seconding of the motion at last week's council, is that the NHS really need to be helped. And I've said this repeatedly throughout chairmanship of the Scrutiny Committee, now it's Vice Chair, and in other places. The NHS need our support, and I hope officers will have some capacity to lend it to them, to bring a project like this forward. Dunstable Health Hub still certainly was full of many challenges and still has some today. And I think lessons from that will be learnt from all sides. But this local authority can help, and I hope it will commit to help when we go back and scrutinise this further. Residents expect us to help with this, and I'm grateful to the acknowledgement that it was never this council that prevented the delivery of health hubs. And some colleagues in this chamber today, Chair, might want to distance themselves from their recent electoral leaflets, where the suggestion was it was this council that was failing to deliver. Now we have an implicit acknowledgement that it's the NHS that needs to deliver this with our help. And by agreeing to this amendment, you are slightly going towards that. So I'm grateful to Councillor Hares and your cabinet for agreeing to that. But please let's not forget that we get the politics we deserve. And if we go around blaming a local authority for not delivering something, we mustn't then stop doing that just because the political party in control has changed. I hope the same logic will apply in 4 years' time, if and when a health hub is delivered. And I'm grateful finally, Chair, that it has been reinstated because, you know, certainly on my side, we've recognised that although it wasn't up to us, and we always knew that, it was important to have it in the capital budget. So this is how politics works. We were very upset when you removed it from the capital programme, but we're extremely grateful that you are, perhaps in a very small way, but nevertheless giving it that acknowledgement that the NHS needs to see from this local authority. Thank you, Chair.